Do an IM injection. First thing I'm going to do is verify the patient's order and compare it to the MAR, and then I'm going to identify my patient and his date of birth and name, and make sure it's the right patient for the right order. And then I'm going to wash my hands and don clean gloves. So once I get the order the doctor has given me is to give Halidol 4 milligrams every 6 hours for severe agitation. So I'm going to perform a focused assessment on my patient for the signs and symptoms of agitation, irritability, or reasons why that he would need this medication. So he does have the symptoms. So I'll go to the medication room and I'm going to pull up Halidol. And so here I have the Halidol, and this is for 5 milligrams per milliliter. So if the doctor is ordering 4 milligrams every 6 hours, and this is 5 milligrams per milliliter, then that would convert to 0.8 milliliters. So I have my medication, I have my needle, and this is a 21 gauge needle, and I have my IM needle. So my intramuscular needle is about an inch and a half long. And that's how you would distinguish that is an IM needle. So I would get my alcohol prep and I would wipe off the top of my vial. And I would get my medication out, my needle. And so now we're gonna pull up 0.8 milliliters of air. Okay, and then we would put the air into the vial and immediately withdraw 0.8 milliliters of Halidol. Okay, so once we get that, make sure there's no air bubbles, and then we would recap. And then we need to change out this needle with the intramuscular needle 21 gauge. So we would sterilely open this, making sure not to touch it. And we're gonna carefully take off the needle that's on, put this in the sharps, and screw in the new needle. So now that we have this ready, we're gonna label it with the medication and the dosage, and because we're outside of the patient's room, and then we would go back into the patient's room and would verify the medication dosage and patient identification for the 3rd time. Then we're going to get started with giving the medication. So for an IM medication, you can give it in the deltoid, the ventrogluteal, or the vastus lateralis. It needs to be given at a 90-degree angle with the Z-track method. I'm going to be giving it in the deltoid using the Z-track method. So I get my alcohol prep and I find my area that I'm going to be using in the deltoid. I'm going to wipe it off, make sure to get it really clean, and work your way outwards. And I'm going to let that dry. And then I'm going to carefully uncap my needle and do the Z-track, putting it in at a 90-degree angle, and I'm going to insert this at 10 seconds per milliliter. So that's slowly. And then after the medication's completely in, then I'm going to hold it for 10 seconds and then take it out. And I immediately go to the sharps with this. I'm going to get alcohol pad, hold it over in case that there's any bleeding or anything happen. And always make sure to aspirate when you're doing an intramuscular injection to make sure that you're not in the vein. And then once that's done, then I'm going to take off my gloves, clean my hands, and then I'm going to document that where I gave the medication, what medication I used, the dosage, and how the patient tolerated it.